Thank you, Mohil Islam sir. And let me thank and congratulate Professor Nasmul Huda and also the University of IUBT. I would like to give a public health perspective on C-section in the region. I would just focus on 5 points. One is C-section is increasing across the region, and the reasons I'll come to that. And I look at one of the major reasons is linked with the family planning practices. Inequity in the family planning burden is one of the factors, because in my fieldwork what I notice is that C-section has got close association with tubectomies. The higher rate of tubectomy during the C-section, there is a relationship that is not explored much. So inequity in family planning access or the bias against women's involvement in family planning is one of the major reasons for the increasing C-section across the region. I'm noticing that. And also over-medicalizing the birth process. So what is its implication, cultural, social, professional issues involved in that. And also disrespectful maternity care. And many of the women, why they go for C-section? Because they don't know the alternatives. And increasingly in the maternity sector, the midwives are guided, or the role of midwives in the maternity care and the family planning is gradually reduced. In certain sector, there is no more midwives are being appointed. And in the popular parlor, we say that midwives are the one who handhold the mothers during the delivery. But if you expand a little more further, the midwives are the one who actually give the answer to the concerns of neonatal mothers, antenatal mothers. So when we remove the appointment of midwives, the support structure for antenatal mothers is removed. That has got again implication on a higher C-section rate. And one of the interventions we should look at across the region is promoting respectful maternity care. And respectful maternity care, information and informed choice is an important part of it. So any mother, neonatal mother, they should have the full information about what are the opportunities, what are the consequences of some of the procedure involved. And also what I notice is that the issue of post-surgical, the surgery site infection. And that's also I noticed that in most areas, post-surgical complications is increasing. In some setting, I noticed that it's about 44% of the prevalence rate is reported that the post-surgical, the clinical the consequences and the complications. So, and finally, post-cesarean support provided through respectful maternity care, enforcing it through policies, political intervention, and also the political will of the government to come out with a protocol for promoting respectful maternity care. So in summary, the C-section is increasing. If I look at the case of Kerala, we notice that we call it as the epidemic of C-section. In some districts, it's 60% of all the deliveries are C-section, and I notice that in Bangladesh, it goes up to 90%. So those phenomena, I should call it as the epidemic of C-section, unwanted C-section, and its implication. And also we look at the children's health, neonatal health, has got implication on the cesarean section. The children who are subjected to cesarean section has got a higher rate of diabetes and cardiovascular disease. So these are some of the observational data. There is a huge need for research and evidence-based data on looking at cesarean section. And most importantly, the indicator of the high level of cesarean section is an indication of the health system's strength and the health system's capacity. And also we should use it as a kind of indicator to look at the health system's reliability and validity to deal with the maternal health. And I summarize it saying that unwanted C-section is increasing across the region, and the regulatory mechanism to control and regulate is very minimal in most of the countries. And the professional competency to do natural childbirth is compromised, or many of the physicians are they're doubtful about their professional competency to do the natural childbirth. So this is a matter of training for the medical profession. And finally, we should use it as a kind of the health equity indicator. The extent of the greater number of C-section is an indication of a large level of health inequity. And I conclude saying thank you to the people who are organizing this, and it's an important initiative to look at health systems across the region and comparative data, and also the need for research to look at how to strengthen respectful maternity care. Thank you very much.